So this paper is collaborative work between the Center for Heart Rhythm Disorders at the University of Adelaide in Australia and the Cardiovascular Clinic in the Hospital Clinic Barcelona in Spain. So what we've done is actually looking at educational information for patients with atrial fibrillation undergoing catheter ablation. So atrial fibrillation is the most common cardiac arrhythmia and the prevalence is increasing. And many individuals utilize the internet as an educational resource, but there's a limited regulation of online patient information. So therefore, we evaluated the quality of web-based patient education resources for patients undergoing catheter ablation in the management of atrial fibrillation. So we performed a cross-sectional observational study to really look into freely accessible online educational resources for this procedure. And we used search engines such as Google, Yahoo, and Bing. We used the PMAT tool to evaluate the quality of these patient educational materials, but also looking into printable tools. Now, the PMAT tool is the Patient Educational Materials Assessment tool, which is a systematic method to evaluate and compare the understandability, but also the actionability of patient educational materials. And it's actually designed as a guide to help determine whether patients will be able to understand the education provided, but also whether they are taking action based on the information provided. Now, we found 17 websites and 15 printable sources, and these were included in the analysis. About 60% of the sources were rated highly understandable, and these were 9 websites and 10 printable tools. 22% of these sources were rated as highly actionable. So these were 6 websites and only 1 printable tool. So what we see is that the understandability of the sources was relatively high, but there is work to do in the actionability.